Dr. Glenda Kaban has been on the front lines of the COVID-19 pandemic, calmly and strategically leading her team, providing not only leadership, but heart too. Glenda has been an emergency room physician for 20 years and is the co-lead of the Department of Emergency Medicine in Regina. She also took on the role of the COVID-19 pandemic lead of emergency. In a time of uncertainty, Glenda stepped forward and used her expertise, experience, and natural affinity for leadership to guide the emergency team through. At the start of the pandemic, when emergency room staff were watching the situation worsen worldwide, Glenda proactively jumped into solution-based thinking and planning. She helped develop practices for the emergency room team and helped develop an airway kit for airway management that keeps doctors and patients safer, a development that became provincial protocol. More than that, Glenda has offered compassion, care, empathy, and support to not only her fellow physicians and everyone working in emergency, but to her patients too. In short, Glenda's fearless leadership has led the emergency medicine team in Regina through uncertain times with grace, confidence, and care.
So I am incredibly honored to be nominated by friends and colleagues who truly feel that what I'm doing is respected and supported, and to have that, for them to take time out of their busy days to even nominate me, that is reward enough. And then to be included in this amazing group of women who are doing such amazing, challenging work in our community, it is humbling and such an honor. So I'm an emergency physician. I've worked here for almost 21 years. And you know, I'm dealing with patients that are in crisis, physical, mental, emotional. And very often we're caring for people who have significant social challenges as well. You know, poverty, unstable housing, unstable home conditions. So that part is obviously incredibly important. But now I'm also a leader in this emergency department and a leader for the team. So I also now am responsible for the emergency physicians and the rest of the emergency team to try to develop processes so we can give the best care possible to our patients. So I feel that's pretty important work. You know, I love my job. I am so very thankful for the work that I get to do. But I also love being a wife and a mother to 3 incredible kids who are now teenagers, and it is very humbling to be a parent of kids who weren't really interested in what I did for work. They just knew that I needed to, you know, support them in what they wanted to endeavor or try. And I always wanted to encourage them to know that the sky's the limit on things that they're interested in doing or trying or be involved with. I mean, as a physician and an emergency physician, patients trust me to give me, you know, their information, their symptoms, their histories, and I get to listen and sort out the diagnosis, I hope most of the time. And if I can't, you know, sort these answers out, I can at least provide direction when they're having, you know, their significant health crisis, whatever it might be, to help navigate through that. I mean, it is a tremendous responsibility, but it is just so rewarding. And now I'm in a leadership position of this team, and it's not just me or a couple physicians. I mean, we've got a team in the emergency department of physicians and nurses and respiratory therapists and pharmacists, and to be able to give guidance and direction and support to our entire team to make us provide the best care we possibly can.